Welcome to the deep dive. Today, we're tackling something pretty common, actually. Things many people experience, maybe themselves or someone they know, but might not fully grasp.
Exactly. We're talking about intrusions, obsessive thoughts, and mental compulsions.
Yeah, and we want to, unpack these a bit. Psychological terms can sometimes feel a bit complicated.
Right. So our goal is to make it clear, drawing on research from things like behavioral therapy and mindfulness, just in a way that makes sense for everyone listening.
And it's actually kind of surprising how widespread some of this is. We'll use obsessive compulsive disorder, or OCD, as a sort of key example here.
Yeah, it's definitely not rare. The estimated lifetime prevalence is around, what, 2.6%?
That's right, which puts it, I think, as the fourth most common psychological disorder, after phobias, substance abuse, and depression. So it's significant.
It really is.
Mm.
And while, almost everyone has an intrusive thought now and then, for people with OCD, these things can seriously interfere with daily life.
How so? Like affecting relationships and things.
Absolutely. Relationships, school, work. In severe cases, OCD can really lead to people avoiding situations, and their lives can become quite restricted because of it.
Okay. So our mission today in this deep dive is pretty straightforward then.
Yeah, let's clarify what these terms, intrusions, obsessions, mental compulsions, actually are.
And then look at some of the, evidence-based treatments that research shows can really help people.
That sounds good. Where should we start?
Okay, let's unpack this. Starting right at the beginning. Intrusions. What exactly are we talking about?
Well, intrusions are basically those unwanted thoughts, feelings, or even physical sensations that just seem to pop into your mind out of nowhere, seemingly.
Right, like a random thought that feels a bit weird or maybe unpleasant.
Exactly. And the crucial thing to get right away is that having these intrusive thoughts, that's a completely normal human experience. It doesn't automatically mean something's wrong.
Okay, that's important. We all have those fleeting, odd thoughts. So how do obsessive thoughts, obsessions, differ from those more general intrusions? What makes it an obsession?
That's the key distinction. Obsessions or obsessive thoughts, they kind of take it up a notch.
Right.
They're persistent, recurrent thoughts or urges or images
Okay.
that you experience as intrusive, yes, but also as really unwanted. And they cause significant anxiety or distress.
Ah, so it's the distress and the persistence. The thought gets stuck, kind of.
Exactly. It's not just the content of the thought necessarily, though that can be upsetting,
Yeah.
but it's the distress it causes, the
Oh.
spickiness, and this urge to somehow neutralize it. They're not just passing thoughts. They linger and really impact you emotionally.
And these obsessions, they can cover a lot of ground, can't they? I was looking at info from like the Lucan Center and the International OCD Foundation.
Yeah.
It seems like a wide range of themes.
Oh, absolutely. Common themes include fears of harm, maybe harming yourself or others,
Right.
an intense feeling that things need to be just right, contamination fears, germs, dirt.
Mm-hmm.
There's also scrupulosity, that's intense moral or religious worries, and even obsessions tied to the postpartum or perinatal period for new parents.
Wow, okay. And that list isn't even exhaustive, is it? There are other types people might hear about.
That's right. You also see things like pedophilia OCD, which causes immense distress because it's so counter to the person's values. Symmetry and order OCD.
Needing things lined up perfectly.
Exactly.
Yeah.
Or balanced. Relationship OCD, constant doubts about your partner or the relationship. Even hit and run OCD, this intense fear you might have accidentally hit someone while driving and didn't realize it.
Gosh. And you mentioned pure O as well.
Yeah, pure O, purely obsessional OCD. That's where the main struggle is with the intrusive thoughts themselves, without maybe obvious physical compulsions that others can see.
So it sounds like the range of what obsessions can latch onto is incredibly broad. But a really key thing for listeners to remember is that these aren't just everyday worries, right? Not just worrying about paying bills or something.
Precisely. Obsessions are different from worries about genuine real-life problems. They often feel, well, the term is ego-dystonic,
Ego dystonic, meaning,
meaning the thought feels totally alien to who you are, your values, your beliefs. It feels foreign, intrusive, which is exactly why it causes so much distress.
okay, that makes sense. It's that clash with your sense of self. Now, after these really distressing obsessions, you mentioned mental compulsions. How do they fit in?
Right. So mental compulsions are these repetitive mental acts, things you do in your head.
Like what? Give us some examples.
Things like silently praying, maybe counting in your head, repeating certain words or phrases over and over, mentally reviewing events to check for reassurance. It's like an invisible ritual happening inside.
An invisible ritual. I like that description. And the purpose of doing these mental acts.
Usually, it's driven by this really strong urge to try and prevent or reduce the anxiety or distress that the obsession triggered.
Okay.
Or sometimes there's a feeling, maybe magical thinking, that performing the mental ritual will somehow stop a feared event from actually happening.
But here's the kicker, right? These mental acts are not actually logically connected to preventing the feared thing, are they? Or they're just way out of proportion.
Exactly. The connection isn't rational. It's not based on reality or logic. It's purely driven by that anxiety from the obsession, not by sensible problem solving.
Gotcha.
And it's helpful, I think, to contrast these mental compulsions with physical ones, even though we're focusing on the mental side today.
Like checking or cleaning.
Yeah. We looked at a study on acceptance and commitment therapy, ACT, and it mentioned examples from participants like checking locks repeatedly, hoarding things, excessive cleaning, constantly checking windows. Seeing those physical examples helps illustrate the broader pattern. Whether it's mental or physical, the function is the same. Trying desperately to get rid of that anxiety the obsession stirred up.
So it's a cycle. This unwanted, distressing thought pops up the obsession. It causes intense anxiety. And then you feel this overwhelming urge to do something to the compulsion, mental or physical, to make the anxiety go down, even if just for a moment.
You've got it. That's the core cycle. And it can become incredibly consuming and hard to break out of.
Okay. So for our listeners who might be recognizing some of this, feeling stuck in these kinds of distressing cycles,
Yeah.
what can be done? What are the ways forward? Let's maybe dive into some of the evidence-based treatments now.
Yeah. Thankfully, there's quite a bit of research, and there are several really effective approaches.
Like cognitive behavioral therapy. CBT comes up a lot. How does that apply here?
Right. CBT is definitely a major player. It's often recommended as a first-line treatment for, well, many psychological issues, but especially anxiety disorders and OCD.
And the basic idea behind CBT is
The core principle really is that by changing how you think and how you act, you can reduce fear and distress. So for obsessions and compulsions, it often involves learning to reevaluate those feared thoughts or situations as less threatening than they feel.
okay.
And a really, really crucial part of CBT for OCD specifically is something called exposure and response prevention, ERP.
ERP. Okay, that sounds important. Tell us more about what that actually involves.
Sure. So with ERP, you work with a therapist to gradually, systematically expose yourself to the things that trigger your obsessions, the thoughts, the images, the situations, the urges.
Facing the fear, basically.
Exactly.
Yeah.
Facing the fear, but in a planned, supported way. And here's the response prevention part. At the same time, you learn to resist engaging in your compulsions.
Ah, so you face the trigger, feel the anxiety, but don't do the ritual, whether it's a mental check or a physical wash.
Precisely. You learn to tolerate the anxiety without resorting to the compulsion. Over time, the brain learns that the anxiety, while uncomfortable, is temporary and manageable, and crucially, that the feared consequence doesn't actually happen just because you had the thought or resisted the compulsion. It breaks that learned link.
That sounds challenging, but I can see how it would work. It probably really matters who you do this with, though.
Oh, absolutely critical. Finding a qualified therapist who really specializes in OCD and specifically is trained and experienced in ERP is key. Ideally, someone certified in ERP, which means they've had advanced training.
Good tip. Okay, now another approach you mentioned is acceptance and commitment therapy, or CT. How does that differ from CBT?
Yeah, CT is often called a third wave behavioral therapy. It takes a slightly different angle. Instead of directly trying to change or get rid of the thoughts or feelings, ACT focuses more on their function and changing your relationship to them.
Changing your relationship. How?
The goal isn't necessarily to stop having intrusive thoughts, which can feel impossible sometimes, right? But to learn how to let them be there without letting them dictate your actions.
So more about acceptance than elimination.
Acceptance is a big part of it, yes, but it's an active acceptance. One core idea is cognitive diffusion.
Diffusion, like unfusing.
Kind of. It means learning techniques to see your thoughts, just as thoughts, bits of language, images passing through your mind rather than absolute truths or commands you have to obey. You decrease how believable they seem and reduce that urge to fight with them or react to them automatically.
Okay, so you notice the thought, but you don't get tangled up in it.
Exactly. And alongside that, ACT emphasizes increasing your willingness to experience difficult emotions, like anxiety, while still moving towards things you value in life. Engaging in meaningful activities even when the discomfort is there.
That sounds powerful, especially for those thoughts that just seem to stick around no matter what. You mentioned a study earlier on ACT for OCD.
Yeah, that study was interesting. It looked at ACT for folks with checking, hoarding, and cleaning compulsions. And notably, it didn't include specific in-session ERP-style exposures.
And what did it find?
It still found significant reductions in the compulsions. The therapy focused on things like identifying personal values and then doing behavioral commitment exercises, basically, taking steps towards living those values rather than letting life be dictated by trying to control obsessions or anxiety.
Values-driven action instead of anxiety-driven compulsions.
That's a great way to put it.
And ACT uses metaphors too, right? You mentioned some earlier.
Yes, metaphors are huge in ACT. They help illustrate concepts that can be hard to grasp just through explanation.
Like the chocolate cake one.
Right. The don't think about chocolate cake exercise shows how trying not to think about something
Hmm.
often makes it pop up even more. It highlights the problem with thought suppression,
Hmm.
or the polygraph metaphor demonstrates how difficult, if not impossible, it is to directly control internal experiences, like feeling nervous on command.
Okay.
And another good one is the two scales metaphor. Imagine one scale measuring your unwanted thoughts, feelings, and another measuring your willingness to have them while doing what matters. ACT suggests focusing effort on the willingness and valued action scale, rather than getting stuck in a losing battle trying to force the unwanted thought scale down to zero.
That really shifts the perspective, doesn't it? From control to acceptance and action. Okay, one more therapeutic approach to touch on. Mindfulness-based cognitive therapy, MBCT. How does that fit in?
MBCT is another strong contender. As the name suggests, it blends mindfulness practices, things like meditation, and bringing present moment awareness with techniques from cognitive therapy.
So bringing awareness to the thoughts. But how does that help with OCD?
Well, a study looked specifically at MBCT for people with unmedicated OCD, mostly mild to moderate symptoms.
And what was the verdict from that research?
It showed MBCT was effective for this group. The improvements in OCD symptoms were actually comparable to what they saw in groups receiving SSRI medication or psychoeducation.
Wow, comparable to medication. That's significant. What did the MBCT involve?
The program in the study was about 11 sessions over 10 weeks. It adapted standard MBCT themes specifically for OCD. Things like exploring the relationship between OCD patterns and mindfulness, understanding the tendency to mistrust one's own senses or memory,
Okay.
learning to validate sensory experience, practicing decentering, which is similar to diffusion, seeing thoughts as mental events rather than reality, and cultivating acceptance of internal experiences.
So it sounds like it's about training the mind to observe the intrusive thoughts and the urge to do compulsions without automatically getting swept away by them, developing a different stance towards them.
Exactly. It's about cultivating that non-judgmental awareness, observing the rise and fall of thoughts and urges without necessarily reacting in the old habitual way.
Okay. And finally, we should probably just briefly mention medication again. You brought up SSRIs in the context of that MBCT study.
Yes, definitely worth mentioning. Selective serotonin reuptake inhibitors, SSRIs, are a very common first-line pharmacological treatment for OCD.
So medication can be part of the picture too.
Absolutely. For many people, medication is a really effective component of their treatment plan, often used alongside therapy like ERP, ACT, or MBCT. It can help take the edge off the symptoms, making it easier to engage in and benefit from the therapy.
Right. So lots of different tools in the toolkit, potentially. Okay, this has been incredibly informative. If we were to boil it down for our listeners, what are the main takeaways from our conversation today?
Okay, let's summarize. I think point number one is crucial. Having intrusive thoughts is normal. It's human. It's the reaction to them, the getting stuck, that can become the problem in OCD.
Right. Don't panic just because you had a weird thought.
Exactly. Second, obsessions and mental compulsions are specific patterns. Persistent, distressing thoughts and repetitive mental acts done to reduce that distress, they can significantly impact life.
Got it.
Third, and this is the hopeful part, there are really good evidence-based treatments. We talked about CBT with ERP, ACT, and MBCT. These therapies offer effective strategies.
Help is available.
Definitely. Fourth, finding the right help matters. Seek out a qualified professional, ideally one who specializes in OCD and the specific therapies like ERP. That expertise makes a difference.
Makes sense.
And finally, there are resources out there for learning more and getting support. The International OCD Foundation website is a great starting point, and there are helpful books too.
That's a fantastic summary. It really demystifies these experiences and, importantly, underscores that effective management is possible.
Absolutely. Just understanding these concepts like we've discussed today can be a really powerful first step towards taking back control. It's so important for listeners to know that help is available and these treatments genuinely work for many people.
So if you're listening and you identify with some of what we've described, or maybe you know someone who's struggling, please do explore those resources we mentioned or consider reaching out to a mental health professional.
Yeah. And maybe a final thought to leave you with. You know, our minds can sometimes feel like they throw unwelcome visitors at us, these intrusive thoughts or feelings.
Hmm.
But you really do have the capacity, the power, to change how you respond to those visitors. And in doing that, you can move towards living a fuller, richer, more engaged life, guided by what truly matters to you.